What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. In today's video, we're covering being an X-ray tech in the ER versus being X-ray tech in the urgent care center. So to give you context, I am a night shift X-ray tech. I've been doing it for 4 years. So I will say, in the short context, if you do urgent care, just know you will be doing a bunch of other stuff outside of X-ray. You always, especially if it's slow, you're gonna have to be doing other stuff. AMA work, CNA stuff, like you'll be doing more stuff. Versus if you do X-ray in the emergency room, you will only be doing X-rays. Always only do X-rays. And if they make you do anything, you tell your manager, and your manager will step in and be like, nah, that's not our responsibility. We are X-ray techs. But in the urgent care, it's a little bit different. So in the urgent care, from what I've spoken to my peeps, if it's really slow, you can be responsible for swabbing people. You can be responsible for drawing blood, running urine, doing all these other, I would quote, nurse/MA type of work that can be tag along to your stuff. I've seen all that. And then I have seen, from my side, we only do X-rays. Like literally, if they order a chest X-ray, just a chest X-ray. And then once the patient starts like, hey, I gotta do this or I gotta do that, you're like, I'm gonna get your nurse. That's how it goes. So whichever one you want to dabble in, if you don't mind doing all the lab and all the other stuff. I will say that usually the urgent cares are a little bit more slower pace, and there's like a little bit less exams as far as X-ray. So I would see why they would want their techs to do that. I personally do not like none of that. That's why I did not go into nursing/MA. All the other, I just want to do X-rays. But if you work in the emergency room, that's all you'll do, baby. Just X-rays, and then all the floral works can be thrown on top of you. If you work in the main, you'll add that too. So that's like the biggest difference between the urgent care and that. I mean, you'll still do basic film X-rays. Most of the time, urgent cares are more cassette, and then maybe certain of them are more digital oriented because they don't know. Like, they're not always on top of it compared to the, hospital who has certain sections that is dedicated to departments more. Because, for the longest time, there's been a tech who worked at one of our own urgent care and, was complaining that their equipment was, so out of date and, no one would understand him until, I think, the board or someone came over there and said, yo, we're going to need you to upgrade your stuff because, this is getting, unacceptable. And then the tech was like, see, I told you. So. And even pay is a little bit less in urgent care from what I've seen. And, I mean, some people like that. If you want to do all that, you can. I personally went to school just to do X-rays. So I dabble in the night shifts, which I enjoy very much. And yeah, if you enjoyed today's video, you can, check out the other ones as I cover very niche, specific topics in the X-ray world, because nobody on the internet and the YouTubes will give you this kind of insight on random specific topics that when you were a student or you are a student, you're like, I wonder, da-da-da-da-da. And you type it on the YouTube and the internet, and maybe there's a video from 2015, old videos, and you're like, well, I need something a little bit newer. Well, I'm your man, giving you all the insights and even exclusive interviews with other medical workers. I have my lady's a nurse. I have family who's an ultrasound. I have family who does PT. I've many aspects of the medical field. I have people in it. They can give me the knowledge I need to educate y'all if y'all are just curious. Yeah, it's been your boy Miguel. See you on the next one.